One of the problems, Orsi, for politicians and policymakers, though, is that we don't live in this transparent world where whichever my ministry is, I'm happy to pay money to help out your ministry. And so we've all come across this in the past. You raise a global issue of gross domestic product and the loss to the economy, and then you're going to a specific department and saying, well, we want you to invest your money to save his or her money over there. Just explain what you think are the best ways we can break down the barriers among policymakers to get this whole issue taken more seriously.
Well, that's a difficult issue, especially in the political reality of today, because 5 years on the crisis and after the 2014 European elections, now we see a totally different political landscape in Europe than we've ever seen before. And the current Commission with President Juncker is an actually much stronger political Commission that we've had before, but they also have a much narrower mandate. It seems that their sole mandate is to focus on job-rich recovery, on inclusive recovery, but definitely on addressing the problems caused by the financial and the economic crisis. And this is not to say that we need to talk about money from here on, because when we talk about chronic pain, we have to remember that we talk about people, and we talk about people who suffer. But when we want to get an issue on the political agenda, we have to realize what are the current priorities on the political agenda, and it's actually growth and jobs. So the work done by Jamie and colleagues working on the quantification on these issues and looking into very strong economic arguments like 10% of the GDP or 20% of people with chronic pain losing their jobs, that can be a very powerful argument to be able to step on the scene with the current political priorities. Another very important hook for the chronic pain agenda is the focus on healthcare workers, because in Europe we are looking to create more and more jobs, and we also see that in healthcare there will be a very strong demand for healthcare workers. So that's an important opportunity for employing a good number of people. Now there are a lot of reasons why these jobs are not filled at the moment, and why we forecast some serious gaps between the available health professionals and the future demand for care. But the Commission is working on a number of initiatives, horizon scanning activities to estimate the future demand for healthcare. We also look into training and new skills for new care areas, into long-term care and into more multi-professional care provision. So these are again very related and important points on the agenda that would be interesting for the chronic pain colleagues to look into.